This year, President Biden proclaimed the month of October as National Youth Substance Use Prevention Month. The White House says last year a record 107,000 Americans died of a drug overdose. More than 1,000 of those were teenagers.
It's a problem Colorado unfortunately knows all too well. An annual report from Kids Count shows drug overdoses among teens more than tripled from 2010 to 2020. That makes drug overdoses the highest increase of the major causes of death among teens, more than murder and suicide.
The Drug Enforcement Administration is going to dozens of schools in the Denver metro to talk to students about the importance of saying no to drugs. It's a part of the upcoming Red Ribbon Week. I spoke with agents and students today at Sherrilwood Elementary, which is part of Westminster Public Schools.
I like it when the Army and the helicopter comes to land and stuff.
I think that's really cool.
While the helicopters stole the show for these kids at Sherrilwood Elementary, the real message behind the effort by the Drug Enforcement Agency and Army National Guard is to teach students to stay away from drugs. It's all part of Red Ribbon Week, which actually takes place at the end of the month. It's a campaign that teaches young people in communities and schools across the nation to pledge to live drug-free by wearing red ribbons and participating in drug events.
Make sure you only take medicine that you get from your parents, from a doctor or pharmacist.
Throughout the nation, there's been recent examples of very young children overdosing on fentanyl or other fake pills that they find, especially here in Colorado. There was one in Colorado Springs.
That's why the DEA says it's so important to teach kids to stay away from items they don't know of at a young age.
We frequently talk to the kids about the dangers of picking up something and eating it, whether it looks like a gummy bear or whether it looks like a sweet tart and something like that, but to always take it to their parents and ask first.
We asked some of the fifth graders what they took away from Thursday's message. Here's what they had to say.
Some drugs can look like candy and it could be very dangerous. These drugs can hurt people, sometimes even kill them.
Sometimes drugs are not safe because you could overdose and you could get sick and die. And they can make you drive your family away. And I like my family. I love them.
A message the district and these agencies hope these kids keep for life. Now, the DEA and Army National Guard plan to visit around 42 schools in the Denver metro by the end of the month.
Going further in depth now, data shows that overall substance abuse among students is actually decreasing in our state. So we looked into the most recent data, which comes from the Healthy Kids Colorado survey done by the state's Department of Public Health. More than 100,000 Colorado high school students responded to the voluntary survey last fall. 24% said that they used alcohol within the past 30 days. That's down from 30% from the last survey conducted before the pandemic in 2019. The data also revealed marijuana use is down 8%, cigarette use is down 3%, e-cigarette use is down 10%, and prescription drug use is down 1%. More than 95% of students surveyed said they had never used drugs in their lives.
We reached out to Colorado's three largest school districts, Denver, Jefferson, and Douglas County. Jeffco got back to us saying it's seen a decrease in illicit substances found on school property. In 2019, nearly 15% of high school students said they were offered, sold, or given illegal drugs on school property. Fast forward to 2021, that number is nearly half of what it was in 2019.
Despite drug use decreasing among high schoolers, school districts are making sure they're prepared for a possible drug overdose on campus. The state public health department tells Denver 7 that 70 Colorado school districts are asking for naloxone or Narcan, which can reverse the effects of an opioid overdose. The state says earlier this year only 14 school districts had requested the medication. Colorado has a hotline to connect people to specialists who deal with substance use disorders. That number to call is 211.